do you think that the aim to improve diagnosis is being addressed during education? And if not, what changes would you make to the current curricula?
So this is Joyce, and in our nurse practitioner programs, we do address talk a lot about improving diagnosis and how important it is and some steps that you can do. And I've taught undergraduate nursing before, and I know that that's also part of the current curriculum. And so, but I think that there can always be improvements made as we learn more from the research that's being conducted on how to improve diagnosis, and keeping that updated in our current curriculum, I think is important.
I assume you know at the Pennsylvania Patient Safety Authority that we have a funded grant to sit on developing a curriculum that's interdisciplinary, cross-cutting, for clinical reasoning, or at least the domains, the competencies, et cetera. So that work is in its second of 3 years, led by Mark Graber, but with a lot of people. And then there's a whole host of other people. I think there were 20 or 30 people at the meeting last November. So that is the interdisciplinary, and it is halfway through its 3-year effort.
I think that's a good point about the interdisciplinary, because I think if we all know where our roles are and where they interact and how we can work together to improve diagnosis, I think is important for all of us in healthcare.
This is Tim. I would say the one area where we've tended to focus on the education is the actual act of diagnosis, the patient-physician interaction, developing a differential, cognitive thinking. And I think one of the areas that we haven't really addressed to the same extent is the fact that this is a process, and it's a systems-based process. And if we use, for example, the conceptual model that's put forth in the 2015 National Academy report, we're actually starting to develop an elective now to say, let's look at diagnosis as from a systems standpoint and begin to look at where are those failure modes that are occurring, what are the key failure points that we have to be thinking of. So we're taking more of I think there's role and opportunity to take a systems approach to diagnosis that perhaps hasn't been addressed in our traditional teaching of diagnosis.
I think those are all good points. This is Helen. And I also think that we need to remember that the patient is part of the team and needs to be included in any of these interdisciplinary programs. I like the idea of patient faculty. That's something we've really been pushing for. And I think, teaching the human element of not just communication, but, of sort of listening and empathy, all of those things, and teaching the importance of uncertainty, which is not necessarily a concept that comes naturally to young people. So I think all of those things need to be emphasized to students while they're young and impressionable.